Coming up on It's Personal, Gundersen Health System is a Children's Miracle Network hospital. Heroes recently announced. We'll talk with somebody about what that means. Also, C-section rates at Gundersen among the lowest in the country. And why is that good news? We'll find out. And a little bit later, Wellness Fest 2014 is coming up. We'll have a guest give you some info about Wellness Fest, and we'll tell you more about this free event. All next on It's Personal, brought to you by Gundersen Health System.
Between kids, the dog, working, and housework, it's hard to know where it all ends sometimes. But when it comes to your family's health, Gundersen Health System is where it begins. We understand you lead a busy life. That's why we provide most of the care your family will ever need, right nearby. From annual exams and broken bones to treating illnesses and chronic conditions, Gundersen is where health begins for your whole family. Need a primary care provider? Visit gundersenhealth.org/families.
As a runner, Michael Bodie thought he was pretty healthy. However, his family history had something different to say.
I ran a half marathon, and 2 months later I had quadruple bypass. One artery was 90% blocked, one was 98% blocked, and one was 80% blocked, so they said, we have to do surgeries. That same day, the surgeon came in.
Like a true champion, Michael found a way to quickly get back in the game.
The minimally invasive route was attractive to me because it offered me at least a chance to possibly recover quicker and get back to my normal life faster than I would have been able to with the traditional surgery.
A leader in minimally invasive cardiac surgery, Gundersen provides expertise and an unmatched level of care.
The folks at Gundersen are rock stars. 2.5 weeks after my surgery, I started in cardiac rehab and actually ran on the treadmill. And a year later, I ran another half marathon.
Gundersen Health System, where caring meets excellence. For more of Michael's story and to learn your risk for heart disease, go to gundersenhealth.org/knowyourrisk.
Welcome back to It's Personal, brought to you by Gundersen Health System. I'm Chris Stauffer. Well, Gundersen Health System is a Children's Miracle Network hospital, and heroes are recently in the news. Joining us now to talk about what a hero is from Children's Miracle Network Hospitals and Gundersen Health System, Amanda Vandehey. Amanda, thanks for joining us.
My pleasure.
Hero, we hear that from time to time about Children's Miracle Network children. What is a hero?
Our heroes are ambassadors for the year. They are speaking on behalf of Children's Miracle Network hospitals and sharing awareness in the community, helping us raise funds, and they've been selected to be heroes because they've all faced challenges and have triumphed over those and have incredible spirit.
It's a really kind of a neat program that's only a couple of years old from what I understand. This year's kids, can you tell us, maybe one or two of the stories about the CMN heroes this year?
We have Zoe Lawler, Caitlin Gruenwald, Tanner Windjam, Alista King, and Sebastian Bishop as our heroes this year. So Zoe, I just saw her recently, and she is doing wonderful. Her family was told that she would never walk, and she is running around the place, and is just a very charismatic little girl and has had more than 20 surgeries, and you would never know it because she just has incredible spirit. So she is outstanding, as well as Alista King, who we are happy to say is in remission right now from Merkitch lymphoma. And so she is from Rushford, Minnesota. And then we have Sebastian Bishop from Onalaska, who is just a bubbly teen who wants to help people understand what it's like to live with diabetes.
Yeah, some great kids, and the idea here is it's really to promote Children's Miracle Network hospitals, of which Gundersen Health System is affiliated, and they really kind of make the rounds in the community. What are some of the duties of a hero?
They have a very busy year. They commit to several events. Many of them are with their sponsors, so they're paired with a Miracle Maker sponsor as well as a Miracle Partner. And we also have a lot of community organizations that host events such as golf outings, and our heroes attend those, share their story, and meet with community members all year long.
It's really a commitment for not only the kids, but the parents too.
Correct.
And those parents are super excited to see the attention that their children are getting.
It's what we've heard is overwhelming. The support from the community and the generosity, it's impressive, and we are so proud to be part of this community because we're constantly amazed by it.
Now, I know that from time to time you get people calling you, wanting to be a sponsor, wanting to have Heroes as a part of their business or their organization. What do they do? How do they get a hold of you?
You can find us on Facebook or the Gundersen webpage at gundersenhealth.org/cmn-hospitals. And you can also call us anytime at 608-775-4424.
I know from time to time you get that business that says, we really want to do something for our community. What a great way.
Exactly, and our heroes are doing this because they are so grateful, and so they're happy to give back in any way that they can, and if their schedule allows, we try to have a family represent CMN Hospitals along with us at any event.
Why not sponsor a hero? Again, we're talking with Amanda Vandehey. She's with the Children's Miracle Network Hospitals, an affiliate of Gundersen Health System, and again, just announced recently the new Heroes. What other kind of things do you have the Heroes doing besides, going out and really, I guess, promoting the Children's Miracle Network Hospitals? Are they ambassadors in other ways too?
They are they're spreading the word any way they can, family and friends. You see a lot of t-shirts out with Team Tanner or different things like that. And so there's a lot of ways that it reaches the community, both at events and on a more personal level, because it really is it's a small world. And when you start hearing those connections, you don't realize the people in your community that maybe have been helped.
Always great to hear these hero stories. And if you'd like to learn more, as Amanda said, you can certainly go to the Gundersen Health System website. That's gundersenhealth.org. Amanda, thanks for joining us.
Thank you.
Again, if you'd like more information about that topic, go to the Gundersen webpage. When we come back, Gundersen Health System, C-section rates are quite low. And why is that good news? You'll find out when It's Personal continues next, right here.
As a cancer doctor, Leah Dietrich wasn't prepared for her own diagnosis.
Really, from the point that you hear those words, you have cancer, your life changes. I felt a lump, and I did what I tell my patients to do, but it was aggressive. The result was a double mastectomy, chemotherapy, and reconstructive surgery.
Always a proponent of early detection, she became even more of an advocate.
I've always told patients and informed them about the benefits of mammograms and self-breast exams. I think I'm even more passionate about getting that message out to my patients and to the community.
As a leader in breast cancer awareness and treatment, Gundersen provides expertise and a level of care that is unmatched in our area.
I've tried to use my experience to help other people, help them know that even though it seems tough, we're going to get through it.
Gundersen Health System, where caring meets excellence. For more of Leah's story and to schedule your own cancer screening, go to gundersenhealth.org/cancer.
Welcome back to It's Personal, brought to you by Gundersen Health System. I'm Chris Stauffer. C-section rates and staples or stitches for C-sections. Joining us to talk about those two topics is Dr. Ken Merkitch, and he is going to talk about, first of all, those C-section rates, which I know is something that he's been proud of since he's been at Gundersen Health System, because the C-section rates are lower. Why is it important that C-section rates stay low?
Certainly. First of all, cesarean sections do intrinsically themselves have some increased risk. Certainly they can be necessary at times, and certainly we do them here, but we know that there is some increased risk versus vaginal deliveries. There's an increased risk of blood loss, about twice as much with a C-section versus a vaginal delivery. There's an increased risk of infection, even if people are given appropriate antibiotics. There's a risk of injury to other organs, such as intestine, bladder, and these risks increase the more cesarean sections you have. And that's an important thing too, because you can't just look at a cesarean section in and of itself. Women who have cesarean section, although we're very proud of being a very pro vaginal birth after cesarean section have extraordinarily high rates at our institution. Certainly if you have a cesarean section with your first baby, you're more likely to have a cesarean section in subsequent deliveries. And we do know that with each baby you have after a cesarean section, and the more cesarean sections you have, there are increased risks for certain complications. You increase the risk for preterm delivery. You increase the risk for the placenta either growing into the wall of the uterus or covering the cervix. So you do increase the risk of changes that can be life-threatening to mother and baby and may actually necessitate hysterectomy to treat. And then lastly, the more cesarean sections you have, the greater the risk of injury to other organs. The bladder often becomes very adherent to the uterus. The intestines often become stuck or scarred to the uterus. So the chance of injury to these organs starts to increase. And people have shown that the more cesarean section you have, the greater the incidence of complications at the time of that next cesarean section. So cesarean sections have increased risk both at the time of the C-section and also the more cesarean sections you have.
So it's not just black and white. It's not just option of A or B, vaginal birth, C-section. There is risk at the C-section level that a lot of women, a lot of men and women are just not simply aware of until...
No. And, I think we've been a victim of our own success. And I think some of this if you look at vaccinations, the same thing. When vaccines first came out, it was amazing. If you go to cemeteries, from the 1700s, 1800s, you'll see a huge number of people dying in young age. What did they die from? They died of epidemics. They died of measles. They died of rubella. They died of rubeola. They died of polio. And when vaccines came out, gosh, these diseases pretty much went away. And now what's happened is because these have gone away, nobody has an experience with them, people worry about imagined risks of vaccines, and then they go on and not get vaccinated. Now we're starting to see increased risks of patients getting German measles, increased risk of groups getting measles. In cesarean section is similar to that in some ways, in that it used to be cesarean sections were only done as a last resort. Why? Because we didn't have blood banks, we didn't have antibiotics, we didn't have safe anesthesia, and if people had cesarean sections, you know what, they had a pretty high risk of dying. And with the advent of more modern obstetrical care and better surgical care and better anesthesiologists are wonderful, those risks start to really decline. And now the risk of dying from cesarean section, although a little higher than vaginal delivery, is not tremendously higher, but it is higher. And I think because we've made it much more safer, I think in some ways we've become more easy to choose that found it easy to choose that option, when you really have to step back and say, and this is starting to happen nationwide, that people start looking and say, you know what, each cesarean section you have does increase those risks.
You mentioned about choosing that. Is that something that women are coming in and asking for?
At times, I would say we have not seen that in our population to the extent that has been seen in, say, inner city, highly urban populations. And I'm not certain as to why that's the case. I don't know if it's that Wisconsin in our area tends to be much more of a natural / back to nature institution. I don't know if just that the fact that our cesarean section rates at Gundersen have stayed so low over time that people are just accustomed to saying, well, that's the way people should deliver vaginally. I can't really tell you why, but it's rare for people to request cesarean section.
Well, let's talk about the rates themselves, where Gundersen is at, where the national average is at, and then maybe even what's happening around the world, around the globe.
Well, it's a great question. So, I alluded earlier to the fact that cesarean section rates in, say in early 1900s were extremely low. It was only done as a last resort. And even if you get into the year 1970, the cesarean section rate was approximately 5%. Well, since then, again, technique has gotten safer for patients. And I think we certainly have expanded the indications for cesarean section. Many times now with twins, that's a choice that is made, and we've had an increase in multiple births over time. For breech presentations, we certainly have had an increase in diabetes in the population, certainly an increase in maternal obesity, people being overweight in pregnancy, which increases size of babies, so there's an increase in cesarean section rate. The national cesarean section rate right now is approximately 32% in the last year. I think that's from 2 years ago now. We've been proud at Gundersen Health System, and I think there's a lot of reasons behind that, to keep our cesarean section rate more about 20%, give or take a little bit. I think in the last year it was about 19%.
That's good news. On the national scene, with the rates being higher. And then on the worldwide population, there are certain countries I know.
Gosh, yeah, you mentioned that. And it's interesting. So in Brazil, in certain populations, the cesarean section rate is as high as about 90%. That's because there's a lot of patient choice cesarean sections. In China, especially if you get into the city populations, the cesarean section rate is as high as 46%. And there's an interesting reason why that was. And I actually have had the opportunity to go to China as a people-to-people ambassador person to talk with Chinese obstetricians. This was back in 2005. Remember, China's a one baby policy, one child policy as a nation, and you're not allowed to have more than one child. If you have more than one child, you get less money from the government. So it's really advantageous not to have more than one child. Well, every family wants the perfect child, wants nothing to possibly go wrong. And I've talked to physicians where they'll get sued and they'll also get hounded physically by patients if anything goes wrong at cesarean section. So you not only have legal suits, but you actually have physical violence. And so with this drug, and we all want perfect babies, don't get me wrong, but in China, the cesarean section rate is quite high because, remember, if you're not going to have more children, some of the risk of cesarean section starts to drop out if you don't have more children because there's risks with each cesarean section you have. So if you're going to have 5 children, and you have all cesarean sections, your risk really starts to increase. If you can have one child, the risk is a little higher, but it's not that higher, not much higher. So that's why in a lot of population in China, the cesarean section rate is about 50%.
Wow, that's absolutely amazing. We're talking with Dr. Ken Merkitch from Gundersen Health System about C-sections, and one of the things that just recently came out was a study about staples and stitches. Can you tell us about the study and what it really means?
It's an interesting study. So when I trained as a resident, we pretty much use staples to close the skin in everybody because it's a lot faster. And that's what the study showed, was that if you close with staples versus suturing, your time of the procedure is about 9 minutes less. So that was the impetus behind it. I would say, in my experience, that most patients really like sutures because they didn't have to come out. Because taking staples out was always a little uncomfortable, although there's been a recent study, not this study we're talking about, but before this, that suggested that patients seem to like staples a little more than suturing, which contravenes my experience, but that's why you do studies. Anyway, what this study was, because people have speculated that suturing better, stapling is better, what they did was they took populations and they made sure they controlled for things like indication for cesarean section, weight of the mother, things like that. And they used the same technique throughout the cesarean section until they got to the superficial layer of the skin. And then they either closed it using stitches in that superficial layer or staples. And what they found was that there was about 57% increase in complications, wound complications, in the group that got stapled versus the group that was stitched. And the reason I think, and when they talked about it, most of those were a separation of the skin superficially, usually about a centimeter or less. So what I think is happening, remember, hospital stays have really gone down over time. Now, when I was a resident, it was customary after a C-section to stay in for 5 days. Now, most patients go home in 3 days, sometimes in 2 days. And there's a desire for patients really to not go home with staples. They want to get the staples out. So by taking the staples out a little earlier, you probably increase the risk that superficial layer of the skin has not quite closed and it's more likely to pop open. Whereas with stitches, which absorb, they used absorbable stitches, there's not that taking that out. It keeps that area of the skin together more. So it's not surprising that there's a little bit less, actually significantly less, risk of complications of that skin separating with stitches versus staples.
So many things, action and reaction. Sometimes it's interesting that a study will point out something like that. Do women request beforehand, or maybe from a previous birth, say, I had staples last time, I would like to have stitches, or vice versa? Is there a conversation that goes on about that?
There actually is. Many patients will say, I had staples last time, or stitches last time, and they'll say, I really want stitches. I've never had anybody come in and say, I really want those metal things in my skin I rather than stitches. I've not had that happen. Now, we've had the one interesting thing with stitches that sometimes happens is that some patients lack a certain enzyme or chemistry in their body to absorb stitches. That happens a lot with Vicryl, which we don't usually use to close the skin, but bear with me here. So I think there's sometimes patients who parts of the stitches need to end up staying in, you have to take those out. That's pretty rare. I've had a couple of patients where that's happened to in my lifetime. And those patients will come in and say, please don't use, it's usually a Vicryl, it's type of suture, Vicryl. They'll say, please don't use Vicryl, use something else, and then you just have to use something else. But beyond that very rare occurrence, in my experience, patients have always requested, if they have any requests at all, and most don't. Most trust physicians to act in what will be their best interest, which is nice to see. Most, if they do request, it's going to be stitches.
And do you have a preference?
You know, since I've been here at Gundersen Lutheran, I've always used stitches just because I think it looks a little bit nicer. I think it heals a little more nicely. But
6 of one, half a dozen of another.
yeah, I've never, until this study came out, I never really, there really wasn't any great prospective randomized data that said, you know, stitches are better. A lot of these were just sort of anecdotal reports where people said, this is our experience. And so right now, there's two ways you can do a cesarean section through the skin. You can go through a sideway or a bikini cut incision, and there's vertical incisions. And people have looked at this over time to see which is better, which is worse, and there's not a prospective randomized study. But I can pull out an equal number of articles that say for someone who's obese, who's overweight, that's the group they really look at, that the transverse or bikini cut incision is better, and I can find almost an equal number of articles that say the up and down or vertical incision has fewer complications. And there's not, so the best way to look at these things is by prospective randomized studies, and hopefully one will come out looking at the type of incision for cesarean section. Now most patients prefer bikini incision, and my hope is that it'll turn out that that's the right thing to do. That's what we do primarily, but it may turn out that maybe it's not.
Mm-hmm. Very interesting, and obviously a conversation, an ongoing conversation for any woman in their doctor's office, maybe even before pregnancy.
Oh goodness, yes.
All right. Dr. Ken Merkitch, thanks for your time today.
Thank you.
All right. If you would like more information about this topic or any other topic, you can certainly go to our website, which is gundersenhealth.org. When we come back, we're going to talk Wellness Fest 2014.
Having recently lost her mother to cancer, Margie Mason wasn't ready for what she was about to hear.
I was faced with stage 4 cancer. Within a half an hour, there were several radiologists in. There was a surgeon consulted, an oncologist consulted.
Together with her care team at Gundersen, she faced her challenge head-on.
One of the neatest things about Gundersen is the No Sleepless Nights program. You go home with an answer. They make sure you have a plan.
Margie became a warrior in her fight against cancer.
When I think of Gundersen, I think of where caring meets excellence. Without that, I wouldn't be sitting here with you today. They knew what to do, how to do it, and how to keep me going. They saved my life.
Gundersen Health System, where caring meets excellence. For more of Margie's story and to schedule your own cancer screening, go to gundersenhealth.org/cancer.
Are you confused by all the talk about the healthcare marketplace and insurance exchanges? There's just one thing you need to remember. Gundersen One. It's a new option from Gundersen Health Plan, which is locally owned and operated. If you need to purchase health insurance for yourself or your family, Gundersen One offers a choice of plans to fit your budget. To learn more or to enroll, visit gundersen1.org or call the Gundersen Health Plan Enrollment Center at 608-775-8092. That's 608-775-8092.
Welcome back to It's Personal, brought to you by Gundersen Health System. I'm Chris Stauffer. Well, the third annual Wellness Fest 2014, is coming up soon. Shayna Schertz, Wellness Education Specialist, Community and Preventative Care Services at Gundersen Health System, joins us now to talk a little bit more about this. And Shayna, Wellness Fest is one of those places where people can just plain get a lot of great information.
They can. We have something this year and every year for someone of all ages. So we truly have something for everyone to do at Wellness Fest this year.
We try to stay healthy. People hear this all the time. We're trying to communicate that all the time. What are people going to learn at Wellness Fest?
We have a number of internal, so Gundersen departments there with preventive care information for folks to walk away with. We also have external vendors, businesses out in the community, just to really educate people on how to stay healthy, be healthy, and make those healthy choices.
Healthy choices, that's always something that we hear a lot about, but sometimes people just don't know how to get engaged with that. And here's an opportunity, and for free, to do that at Wellness Fest. Talk about some of the screenings and some of the things that are going to be happening there.
Sure, we'll have health screenings such as blood pressure screenings. We'll have displays. We have a newborn behavioral observation for newborns. It's a screening for them. We also have a variety of do-it-yourself demonstrations by the Home Depot, fresh finishes by Stacy and Floral Visions, as well as a fashion show by Macy's. We have a lot of things for the little kids to do. So we have bikes. Limited will be doing a bike fitting and safety inspections for any bikers that want to come on down with their bikes that day. We also have free helmets to give away to children coming while supplies last that day. And then we have a few workshops for the kids from the Home Depot, the parenting place. So as last year, kids can go and build something with the Home Depot.
Let's talk about what sort of the reaction is when people go to Wellness Fest, because there's a lot of people that are listening to this program that are saying, I've never been to Wellness Fest, maybe I haven't heard of it. So what are you hearing from people who have been to the past couple and come back? What are they saying about Wellness Fest? What's sort of their reaction?
People really like that it's a family event. So there's truly something, like I said, for someone or everyone to do there. So it's a really good family event. Being held, it's on the weekend, it's at the Lacrosse Center. So it's just a good location. Can come on down if the weather's nice, like I said, take a walk down by the river, bike down, bring your bikes in for that bike fitting and safety checks.
Saturday, July 26th, I almost said Sunday, but Saturday, July 26th, and it's from 9 a.m. until 1 p.m., and as you mentioned, it is at the Lacrosse Center. I know when each year this is sort of growing and growing. Where do you see this? Where do you see Wellness Fest going in the future? Is this something that you think can expand? Because it seems like more and more people are kind of, jumping on board.
Each year we obviously hope to expand it and make it a better and bigger event and try to incorporate something for everyone. This year we have a pretty good grip on it. Next year, obviously, we hope to increase that and offer even more than we do this year.
You're encouraging people to bring their entire family down, their grandpa and grandma, and bring down the little kids too, because there's so many just different things. Talk about what's happened in the past with things that the kids were able to do at Wellness Fest. Not necessarily this year, but because we don't know what's going to be happening there, because vendors put on different things. But in the past, kids have really been able to kind of dig right in.
Sure. So we had kids were able to do some finger casts last year. We had some frames and I think birdhouses or something from the Home Depot that kids were able to build with a little bit of help from their parents or family members. We had a nice play area that family and can play with their children from the parenting place. So they have a lot of different activities in there. And then of course the free bike helmets. Everyone likes to go and get fitted for those and get a new bike helmet if theirs is not fitting them properly right now.
And that's something that we've learned a lot about too. As kids grow, they do need to have those helmets updated. A helmet that worked last year might not be working yet this year. Talk about, if you would, just a little bit about when people come in, what do they need to know to come to Wellness Fest?
It's a free event, so just come on down to Wellness Fest. If you are looking to purchase some things, I know we really encourage our external vendors to bring products that they can sell. So maybe bring some money if you want to walk away with some items from different area businesses that day.
Mm-hmm. And lots of freebies too.
Lots of freebies. There's also always lots of good freebies.
Good freebies and good information too at Wellness Fest 2014. And again, as Shayna Schertz mentioned, it is coming up on Saturday, July 26th from 9 until 1 p.m. And there is also one other component that's been added this year, Shayna, that people should keep in mind as they head down to the Lacrosse Center.
Yes, this year we are doing a food drive to help local food pantries. So if you're coming on down to the event, bring a non-perishable food item, and we will have the truck out front to drop that off to help a local food pantry.
All right, great idea. Shayna Schertz, Wellness Education Specialist, Gundersen Health System, and Wellness Fest 2014, as mentioned. It is Saturday, July 26th from 9 till 1. If you'd like more information, you can certainly go to the Gundersen Health System website. That's gundersenhealth.com. cmn-h.org. And that wraps it up for this edition of It's Personal, brought to you by Gundersen Health System. I'm Chris Stauffer. Thanks for joining us.